My name is Kip Clark from Ultimate Advanced Bodywork. I'm a specialist in the treatment of chronic pain conditions and an advanced clinical massage therapist. Today I was going to talk to you about how to use rehabilitation exercise to help with carpal tunnel syndrome, golfer's elbow, tennis elbow and repetitive strain injury. Right, so this will be particularly useful for office workers or obviously anyone suffering with those conditions. The first exercise, we'll just do one arm just to save on time. First exercise, basically all you do is simply flex and extend the wrist. So I'm curling my fingers all the way down like that and taking them back, and as I bring the fingers back I'm allowing the fingers to curve naturally forward. So you're going down, up, and you just do this 30 times. Okay, so 1, 2, 3, 4, 5, 6, 7. While I'm doing it, I'm also trying to keep the wrist relaxed so that all the muscles and joints in there can actually relax and get moving. So you're not tensing the wrist, you're trying to let it be relaxed and easy. You just get that moving, and as you go more and more you'll feel all the joints start to move and it becomes a little easier. Right, the second exercise we're basically doing, it's another mobilization exercise, but it's basically like you're waving. So you're trying to keep the wrist still and just move the hand. So you're going all the way that way, all the way that way, as far as you can. Make sure you're not moving the arm around, you're actually just moving the wrist. So again, do 30, and again try and keep all the bones and everything within the wrist nice and relaxed. So. The other thing to make sure is that you keep the wrist in line like that. Try not to bend the wrist round to the side or anything. You're trying to keep it moving in a straight line like so. Okay, the third exercise is basically, it's actually a massage technique you can do yourself. It's to release this retinaculum, this band of kind of ligament-like tissue around the wrist. And basically what you do is you compress into the tissue around the wrist with your other hand, and then you gradually curl your fingers forward. And you're only curling your fingers down as the tissue releases in the back of the hand. So let's do that on the right side. So you get a good lock on the tissue, and again gradually curl it down as the tissue releases. I'll do 2 or 3 passes on each side, different areas of the wrist. Come in there again, get another good lock, and again gradually curl the fingers down, but not rushing it, just waiting for that tissue to lengthen and release. Okay, you can spend a couple of minutes also kneading the muscles in the forearm. It's not as good as getting someone else to do it, but it's still beneficial. So we're really working into all these muscles on this side and in here as well. It's good to do that before you do some of the stretching, really loosen it all up, help free the muscles that are all stuck together. And again, working down this side, I find it's quite useful to just use the palm of the other hand to knead deep into the tissues, like so. You can see I'm getting some nice redness there as the blood comes back into the tissue. Okay. Right, we're going to do some stretches now. First off, we're going to stretch the finger extensors. This stretch is particularly important if you've got tennis elbow, which is on this side, golfer's elbow is on the other side. And what you do, if we're stretching the right hand, we put the left hand around the knuckle and use the bottom of the palm to catch the fingers there. And you take a breath in, breathe out, and I'm gently easing my knuckles towards my elbow. but I'm not forcing the stretch, I'm just waiting for the muscles to lengthen and release. So just waiting, and you'll feel all the back of the forearm start to lengthen. When you start to feel a good stretch there, then start curling the fingers up as well, curling the fingers up with the bottom of your palm, because you're trying to get the wrist extensors and the finger extensors, the two different muscle groups. And again, you want to hold any of these stretches for 30 seconds. Most people don't stretch for long enough to allow the body to relax into the stretch. So just curling those fingers up, putting the knuckles in. We're just trying to relax and not force the stretch. Okay, next one is the extensor stretch. This is particularly important for golfer's elbow, pain in here. So I find it's good to, you can do it against a wall, you can use the wall to lean into, or I find if you grab the fingers, and I use my thumb to support this bit here, and if you take another breath in and breathe out, and again I'm just pulling my fingers back towards the elbow. Important to keep breathing and relax while you stretch. Okay, and obviously we're feeling the stretch on that side this time. Another good stretch from martial arts, you can actually, you hook your fingers over the outside of your hand here, like so, put your thumb up here, and then you can actually do it as a mobilization as well, so you're pulling the wrist in towards you and letting the wrist bend forwards, so the wrist doing that movement, and you can mobilize the wrist quite well like this, and you can also do it as a stretch, and maybe do a few mobilizations and then hold it and relax into it. It's more a stretch into the joint rather than the muscles and tendons, so you might not need to hold it for as long. Okay, again, so that hold is like that. Right, median nerve stretch. The median nerve gets impinged in carpal tunnel, causing numbness and tingling in these fingers here. A good way to stretch it is to actually use a desk or hard surface put in front of you. Again, what I'm going to do here is I'm going to use the thumb against the surface. I'm going to grab around the other side of the hand here, and again you take a breath in and you actually twist the hand around like that. So we're actually using the thumb against the hard surface, twisting around to lever that area open, to open this out for the median nerve. So, if I take a breath in, breathe out, I'm just rotating, twisting it around, and again, because it's a stretch, I'll hold it for quite a period of time. Might need to reposition a bit as the tissue opens out. Okay, the last stretch we'll show you is a stretch for the traps and the scalenes muscles here, because often they're involved with problems in the forearm and they can compress the nerves and arteries coming down the arm, adding to the problems. So this one, if we're stretching the right side, we take the head to the left. So you take a breath in, you're keeping the shoulder down and back, and at the same time you're taking your head to the left with your face forward. So if you take a breath in and breathe out, I'm trying to keep that right shoulder down as we stretch the area. so that's all the rehabilitation exercises we'll show you today. Remember, rehabilitation exercise alone is often not enough to get rid of these problems. Often you need advanced clinical massage as well. Also, obviously consult a doctor or physiotherapist concerning any medical problems you have or more serious musculoskeletal issues.